This video provides instructions for how to complete a reauthorization questionnaire. The purpose of a reauthorization questionnaire is to obtain continuing authorization for treatment services when nearing the end of the current authorization for services. ACE will let you know when it's time to begin this process. ACE uses the scrolling alert bar and the inbox message system to instruct the user when to complete a reauthorization questionnaire for a specific active patient. ACE activates this alert 21 days prior to the current authorization end date and will give the user a due date of 14 days prior to the current authorization end date. Why does timeline matter? As it is right now, providers have to submit requests for authorization 10 days prior to the current authorization end date to avoid a lapse in service authorization. ACE is programmed to help the clinical user and the admin team maintain continuity of care and not experience a lapse in service authorizations. Let's tap on the reauthorization questionnaire message and see what it says. In this example, the subject line in the inbox message indicates that a reauthorization questionnaire is due on December 3rd. There's also an attachment which is a link to the patient record. The message provides instructions to complete an evaluation and/or plan of care, if warranted, prior to completing the reauthorization questionnaire. When is a new evaluation warranted? When it is clinically necessary due to a change in the patient's medical status, or when new clinical information is needed, such as a change in diagnosis. An evaluation is also warranted when it is expiring within a short period of time. In this example, the annual evaluation is not due until June of the next year, so there isn't a date-driven reason to complete a new evaluation. The clinician simply has to consider if there is a clinical reason to do an evaluation prior to writing the reauthorization questionnaire. When is a plan of care warranted prior to completing a reauthorization questionnaire? When it is clinically necessary to update the goals. The plan of care is the only place in ACE where the clinical user can mark goals for the patient as met, discontinued, or add new goals. A new plan of care is also warranted when it is expiring within a short period of time. In this example, you can see that the plan of care is expiring on December 6th. A new plan of care is warranted prior to writing the reauthorization questionnaire because of the date that it's expiring, and because it's clinically necessary to update the goals to be targeted in the next authorization period. It is simply important that you give careful consideration to the service delivery variables prior to completing the reauthorization questionnaire. This information bears repeating. If the patient's plan of care is due, the patient has met or discontinued goals on the current plan of care, or the user desires to add new goals to the plan of care, the user must update the plan of care prior to completing the reauthorization questionnaire. This is done by accessing the patient record and tapping on the plan of care button. Once the plan of care is signed and thereby filed in the patient's EMR, the user may continue the process for the reauthorization questionnaire. Returning to our reauthorization questionnaire process, the first step is to gather what is needed to complete the document. Start by accessing the patient list and tapping on the specific patient's row. Prior to starting the reauthorization questionnaire, the clinical user will first need to open the evaluation from the patient's EMR tab. The most recent evaluation information must be included in the reauthorization questionnaire, and the best way to do this is to reference the evaluation documentation as you are entering the data into the reauthorization questionnaire forms. The clinical user will narrow the search for the document type Evaluation and then tap the Search button. The search results will open to the default ACE viewer. The clinical user will need to change the viewer to Local by tapping the radio button. This will open the document using a different application on the user's device, most often Adobe. By opening the document outside of the ACE program, the user can toggle back and forth, completing ACE documentation forms while also referencing relevant patient EMR documents. Returning to the patient record, the clinical user will tap on the Documentation tab and then tap the button for Reauthorization Questionnaire. The programming for reauthorization questionnaires is the same as the plan of care and the initial authorization questionnaire. The authorization questionnaire does not save and must be completed in one session. When the user attempts to exit the questionnaire before completion, ACE will alert the user that all of the data will be deleted and ask the user if they're sure they want to exit the questionnaire. It is best to ensure that you have adequate time to complete the reauthorization process from start to finish before beginning the process. ACE will auto-populate the start date with the date after the current authorization end date. In this example, the current authorization will end on December 12th. ACE has auto-populated the start date of December 13th. The user can change this date by tapping on the blue calendar button. The user can change the start date by tapping on the calendar option, or by tapping the button to make the current plan of care begin date the beginning date of the reauthorization request. This alteration of a start date is necessary when the clinician is requesting a new authorization of services because the frequency of the plan of care has increased. Funding sources require prior authorization of services when services are increased by adding a new CPT service code or by increasing the frequency of services. The clinical user is responsible for completing a reauthorization questionnaire and receiving the new increased authorization for services prior to seeing the patient for the increased frequency. The clinical user will tap the blue calendar button to identify the end date of the authorization request. The end date can be entered by tapping on the calendar, the current plan of care's end date, or can be calculated 6 months after the start date. Typically, authorization requests are for 6 months from the start date. A clinical user would choose the current plan of care end date if their plan of care is shorter than a 6-month duration. Once the dates are entered, the user will tap the green Continue button. ACE will next display the current plan of care goals. Goals that have a number listed in the Goal Number column are goals that were targeted in the last authorization period. Remember those funding goals? These are the goals that you identified on the initial authorization questionnaire as top prioritized goals for the plan of care. ACE has been tracking them the whole time. The user will enter the current level for the goals identified on this form. You can tap the Copy POC % if you just wrote a new plan of care. Or you can enter the current level as of the last therapy session if you did not write a plan of care prior to completing this authorization questionnaire. The user will tap the yes or no checkbox in response to progress since last auth. For goals that are old funding goals, or those goals that were targeted during the last authorization period, the user will need to address if progress was made. Hopefully the response is yes. For any new goals, the user will tap no to this question because this goal was not targeted during the last authorization period. ACE will use this form to simply display funding goals that were met during the last authorization period. Remember, a user can only mark goals as met on a plan of care document. Any funding goals that were marked as met on the plan of care during the authorization period will display on this form. ACE will next display the funding goals that were discontinued during the previous authorization period. Again, goals can only be discontinued by means of a plan of care. That is why it's important to update a plan of care document and to sign it prior to completing the reauthorization questionnaire. If one or more of the funding goals were not met or were discontinued during this authorization period, the user must indicate the barriers to progress for those goals. If all funding goals were met, the user can simply tap Other and write All Goals Met. Have the barriers to progress been resolved? If so, tap Yes, and then provide details about the barriers and their resolution. If not, then tap No, and then provide details about the barriers and the lack of resolution. When all funding goals are met, tap Yes and write All Goals Met. Then tap the Continue button. ACE will display the current short-term goals from the plan of care. The user will again assign a number 1 to 5 to identify the goals that will be used to request authorization of services. These goals will be tracked as funding goals from authorization to authorization. The next question asks if the services being provided are in the child's primary or proficient language. Here's a hint. The answer to this question should always be yes. We cannot provide speech therapy services to teach a patient to speak a second language. ACE will auto-populate the skilled interventions identified on the recent plan of care. The user will toggle between the recent evaluation displayed in another application on their device and read it to identify the functional limitations and test scores and input it into this field. The user will then tap the Sign Authorization Questionnaire button, enter their password, and tap Sign. ACE will provide the user with a confirmation message indicating that the document has been signed and filed in the EMR. It will also remind the user to sync their data. It's important for the user to sync after completing an authorization questionnaire because ACE will send an alert message to the administrative group so that they will know to enter the authorization request into the funding source's authorization system. Once therapy services have been authorized, the clinical user will receive a scrolling alert and inbox message. Tap on the message to open it and view the authorization details. This inbox message contains a link to the patient record and alerts the clinical user of the authorization dates and number of authorized visits. The user can view the authorization in the patient's EMR under the document type Authorization. This inbox message does not automatically delete. After scheduling the patient's recurring appointments, the user should delete this message by tapping the Delete Message button. This concludes the reauthorization questionnaire instructions for ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.